Okay, so it's 1:30 now, so good morning, everyone. My name is Erin Higgins, and I am the program coordinator at the National Association of Federal Retirees Ottawa branch. I would like to begin by acknowledging that the land on which the National Association Federal Retirees Ottawa branch office is located is traditional unceded territory of the Algonquin and Anishinaabe people. On behalf of the Ottawa branch, I am pleased to welcome you to today's webinar from Hospice Care Ottawa entitled Providing Comfort, a Learning Session. We welcome our presenter, Lisa Sullivan, Executive Director of Hospice Care Ottawa. Lisa led the integration of 2 hospices in Ottawa to form Hospice Care Ottawa in 2013. Lisa works with her board, volunteers, staff, and many generous donors in Ottawa to ensure Hospice Care Ottawa offers the highest quality service, including community support and residential care for people living with a life-threatening illness. Lisa is passionate about finding ways to improve the palliative care system in our community to better support people on their end-of-life journey. I'd like to give a special welcome to anybody here who is not yet a member of the association. We hope these webinars will inspire you to join us. And to our members, we hope that these webinars will encourage you to maintain your membership. Remember that you can give the gift of membership. To learn more, please click the link in the chat box to access the National Association website. After today's webinar, the Ottawa branch will send you an email with instructions on how to access the recording of today's webinar and how to join the association. Remember that you can always invite a non-member to register for our webinars as a guest to try us out for free. There will be a short question and answer period at the end of the webinar, so please type your questions in the chat box throughout the session, and I will read them out loud for Lisa for her response. I'm now going to turn the presentation over to Lisa. Thanks so much.
Great. Well, thank you very much, Erin, and thanks to all of you for inviting me today to talk about hospice palliative care and specifically about Hospice Care Ottawa. As Erin mentioned during the presentation, if you have questions, please put them in the chat box, and I may not see them at the time, so we'll talk to them at the end of the presentation, and I hope to have lots of time for that. And I hope that you do have questions, because the discussion is always the best way to learn, I think. I wanted to start with sort of a more general topic and just looking at what is hospice palliative care. And there are lots of myths around about what is hospice palliative care. So to draw you in the beginning, I have a number of statements that I'm going to ask you to think about. And maybe if you have a pen or a pencil close by, you could just jot down whether you think it's true or false. And we will come back to that at the end. And hopefully I'll have answered some of those things for you. But it's really meant just to get you thinking about what is hospice palliative care and what it might mean to you. So the first one is, receiving hospice palliative care means you'll die soon. Just think about whether you think that's true or false, a myth or a fact. Most Canadians want to die at home. Hospice care is meant for cancer patients. Narcotics or medications are used in palliative care to hasten or quicken death. Talking about dying causes too much stress for my loved ones. And everyone in Canada has access to high quality hospice palliative care. Okay, so just hang on to that and we'll come back to that at the end. So I'm going to start with my cartoon that I share when I talk about hospice palliative care, because I think this cartoon is actually the best definition of what hospice palliative care is. In the cartoon, Charlie Brown says, "Someday we are all going to die, Snoopy." And Snoopy says, "True, but on all the other days we will not." And why that's important is that hospice palliative care is really about supporting people while they're living, increasing that quality of care, and helping people to live until they die, which is an expression you may have heard. So the focus of hospice palliative care is on living and supporting people before they die. I'm having trouble changing slides. Why is that? There we go. So to be a bit more specific, hospice palliative care, as I said, aims to improve the quality of living and dying. It's about improving your self-well-being. And it's for anyone living with a life-limiting illness, regardless of what the disease is, regardless of your age, gender, culture, ethnicity, abilities, sexual orientation. It is meant to support people during that journey of living with a life-limiting illness. And it also seeks to support, or mainly seeks to support, life experiences so that we can start looking at what is meaningful in your life and what might be valuable to you and your loved ones, whether they're family or friends. The focus of palliative care is on comfort. And we do see dying as a natural process. So with hospice palliative care, the philosophy is to support people in the natural process of dying. Some of you may have a question about MAID or medical assistance in dying. And while that is a legal right and a human right and permitted in places like our hospice, not all hospices, it is not part of the philosophy of care, because our attempt is to support people and not hasten death, but support them in that natural process. When we think about hospice palliative care, we think about the whole person, not just their disease or their body parts. So that includes the psychosocial aspects of their life. A lot of hospice palliative care focuses on the family and the loved ones who have generally been the caregivers or the ones looking after the person for a long time. Care is provided by a team, so nurses, physicians, social workers, and key, I'll talk about a bit later, is our volunteers. Hospice palliative care can actually influence the course of an illness. While the goal isn't to extend life and it's not to treat an illness, many studies show that getting good hospice palliative care, because it improves people's well-being and quality of life, actually does increase their time. And it is important to have hospice palliative care early. One of the statements we had is a myth that getting hospice palliative care means you're going to die soon. We have many people, for example, in our programs who have been with our programs for many years, in our day programs or home support programs. And the earlier that you can start accessing resources to support you in that life journey, the better you'll do throughout the illness. And hospice palliative care does not stop when someone dies, and we consider grief and bereavement support to the family and loved ones as a really important part of hospice palliative care. So what do we mean by the word hospice? Often the word hospice, you'll hear me say hospice palliative care or hospice or palliative care. Often those words are used in conjunction or separately. So the definition of the word hospice, the original definition, was a place of shelter for travelers on a long and difficult journey. And I think that's an interesting definition. It's not the one we use now, but it does make me think about the shelter and the support for people who are on that journey of life. Unfortunately, the word hospice in the French language has a bit more of a negative connotation. The word hospice can mean sort of a poorhouse, or in 15th century France was considered a sort of a house of ill repute, if you will. And so it has a bit of a negative connotation in French. And so one of the reasons we use the word palliative care is because we can translate that word better. So palliative care is soins palliatifs, which doesn't have that negative connotation. But I do think this definition is interesting, because while hospice isn't necessarily a place, it's a philosophy. It is that support or shelter on that journey. The modern day hospice, as I said, is a philosophy and not a place. Hospice care, palliative care can be delivered anywhere. It doesn't need to be in a certain building, hospital, home, wherever. But the founder of the sort of that modern day term is Dame Cicely Saunders, who some of you may have heard of. She founded the famous hospice in England in 1967. She was a nurse and a physician. And really at that time, the reason hospice was founded was because that was the age of, we had new medicine, we could cure things, we wanted people to get better. It was acute care focused. And there were people who were dying who were not getting attention in hospitals or anywhere else because they felt that there was nothing we could do. And so she saw that as something that had to be addressed in terms of supporting people. And I mentioned that the word palliative care sort of came into being, and it was actually a Canadian who brought that word to the world front and is used internationally now. In the 70s, Dr. Balfour Mond, he's actually still alive in Montreal, he coined the term palliative care for the reason that I talked about, is that because especially in the French language and in Quebec, hospice still had that negative connotation. And so soins palliatifs sort of more accurately described what we're talking about when we talk about hospice palliative care. So one of the most famous quotes that came from Dame Cicely Saunders is this: "You matter because you're a you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die." And there's that term again, living until you die, which is really that philosophy of what we're talking about in hospice palliative care. So why do we need it? Well, I think most of us as Canadians believe that we have the right to access good quality care. We're an aging population. We know that the baby boomers are aging faster than any other cohort right now. And whether we like it or not, the older you get, the more chances that there are that you're going to die. So we are going to have a population of older people living with chronic illness and life-limiting illness. And currently, I don't think we have the services to really support those needs. Most people, 70% of Canadians, would prefer to die at home. And if not at home, in a home-like setting. And so what we find is that the majority of people, you may end up in a hospital with a serious illness. But hospitals, while they're very good at acute care and fixing things, they're not so good for people who are trying to live out their last days in any kind of quality way. The noise, the lights, the constant action, the uncomfortable beds, that's not the way most people would prefer to die. And certainly in COVID, it's brought a lot of this to light, because this has been a really challenging time, not only for hospitals, but other settings as well, to create that sort of home-like environment for people that's comfortable. In the city of Ottawa, which is where our services are provided, there are an inadequate number of services for hospice palliative care. We have, and I'll talk a bit later about that, we have 21 residential hospice beds, which is care for end of life. And then we have a number of services in the community for people living at home with a life-limiting illness, whether that's day hospice or in-home visits. We are fortunate that we do have Rogers House in the city, which offers care for children who are palliative. We do have the Mission, which offers support for those who are street involved or homeless. So we do have those services, and we have some major hospitals, including Elizabeth Bruyere, who has a palliative care unit. But what we know from the studies across Ontario is that we probably need 10 residential hospice beds for every 100,000 in our population. And so clearly, even with all those services, we're not meeting the needs when we have a population of about 1 million here in Ottawa. And we know, as I mentioned, people don't want to go to hospice at end of life, but there's also that whole issue of being in hospital during COVID. There's a shortage. People are in inappropriate care and end up in emergency room, which is expensive. It's very expensive to the system. When we have people who are palliative or living with a life-limiting illness using a bed in a hospital, that takes away a bed from an acute care person who could use it. Likewise in the emergency room. But the cost of having someone in a hospital bed versus, for example, in a hospice The cost is anywhere from $1,500 a day and up in a hospital. And we know the kinds of services that we can provide in hospice are less than $800 a day, or much, much less if we're looking at services in the community and trying to prevent people from having to go into emergency in the first place. And the other thing we know is that people are very satisfied when they receive the kind of hospice palliative care that we at Hospice Care can provide. And there's some very good data across the province showing that indeed it is not only cost effective, but it is something that people want and are happy to have been involved with. So before I go any further in talking about hospice palliative care and why we need it, I wanted to spend a few minutes for you to think about your own values and what might be important to you at end of life. And again, this is totally voluntary, but if you have a pen and paper handy, just give it a thought. This is just an exercise to get us to think about what's important to us. So in each window of the house, try to write down an activity or something that is meaningful for you in your life, things that matter, that you think are the most important things that you do in your life. I'll just give you a moment there, and if just fill in a couple of windows, you don't need to fill them all in if you're. Okay, well, I hope that you gave that a bit of a try. For me, for example, I would have written something in like playing with my grandson, or spending time with my family, playing cards. I might have put having celebrations at certain events. I might have walking the dog. Those are things that are important parts of what I do in my life. And so when we think about that, then I'd ask you to look at those things that you wrote down and take away 2 of them. So if you only could have 1 or 2 of those most important things in your life, what would they be? And what it boils down to, and the exercise as we work through it, we would keep taking away 1 thing. And what the exercise is designed to do is to help you think about, okay, what's important to you at end of life? If you don't have the capacity to be doing some of those things that you want to do, or you're bound to a hospital bed, or you're not able to get outside, what are those most important things that you want? And how can we make sure, and how can you make sure that those things are kept up on this last leg of your journey? It also helps us to realize how tough it might be for people who are in a situation where they are end of life and can't do those things that are so important to them. It helps us sort of understand where people might be coming from. What this boils down to, and I urge you all to think about this, is what we call advanced care planning. Now, I'm not going to spend a lot of time on it, but I think when you think about the house exercise and you reflect on what's important to you, it does make one realize how important it is to think about that in advance of a time where you might need hospice or palliative care. It's very important that you communicate your wishes, verbal, written, or otherwise, when you can, and make sure that somebody knows where those are. Somebody that you trust knows what your wishes are, so that you can make sure that you have what in Ontario is called a substitute decision maker, able to make those decisions if you cannot. So in advanced care planning, they often talk about, would you go parachuting without a parachute, as a joke, because would you? You wouldn't, of course. And advanced care planning is sort of like that. It's like we all know we're going to die. We all know there's going to be likely a period of time when we are dying. So why wouldn't you plan ahead to make sure that you have things in place? Not wills and whatnot are very important, but also about the kind of care and the values and the things that are important to you at end of life. I will send the slides out after, but there is a website. We have excellent materials in Ontario. Speak Up Ontario is actually a workbook that you can work through yourselves to help you think about what those values are, and also develop a plan that you can share with your loved one or talk to your loved one about if you wish. So it's a great resource, and there are other resources that are available as well. So let's move on to thinking about who we are at Hospice Care Ottawa. I've tried to give you an overview of what hospice palliative care is and why it's important. Hospice Care Ottawa is an organization. It's a community-based charitable nonprofit, and we provide the hospice palliative care to anyone living with a life-limiting illness, and it's at no cost to them. So you'll learn later that we have to fundraise a significant amount of money to ensure that we can provide those supports at no cost. We are able to do that. We do get some government support, but we do it because we have many, many volunteers and many generous donors who make that possible. Our mission, as I've already pretty much said, is to provide the compassionate, high quality care to people and their caregivers from the time of diagnosis with a progressive life-limiting illness through their palliative and end-of-life journey. And our vision is to promote that quality in life, compassion in death, and support and bereavement to people in need across Ottawa. So that's who we are. Of course, we do have a strategic plan and we do have strategic priorities, certainly about excellence in our care. We're look very much and work with our partners about how we can increase access to services. And part of that increasing access is addressing some of the diversity issues in our community. We look very much at how we work with our partners and strengthen the involvement. The healthcare system's ever changing, and really important that we stay linked in and involved with it. And ensuring financial sustainability is also a huge priority given our funding situation. But then COVID hit. So my little cat here says, once COVID-19 is over, is starting to sound a lot like when I win the lottery. So I think every month since this pandemic began, we'd say, we'll get to that priority once COVID is over. Now, of course, we have been living this pandemic for over 2 years now, or I guess just about 2 years. And so that's been a challenge for us as a small organization to meet some of our larger organizational goals. However, we have persevered, and we have, thanks to just amazing group of people, we have been able to provide that care for our clients and families. We have kept our residence care open, which has allowed people to come in, not as many, but we've been able to have people come into the residence. We've had to have a lot of our community programs be virtual. So a lot of these Zoom type meetings as a way to support people. And it's ever changing every week, it seems. So I'm hoping now we're on the up. And our goals and our priorities were, as I said, focused on that quality care, but also on creating that health and safe work environment for our employees and our volunteers, because like everywhere, COVID has been a real challenge. So where are we located? We actually have 3 sites in the city of Ottawa. The Maycourt Hospice site is in Old Ottawa South. It's one of the oldest hospices actually in Canada, and it is supported generously by the Maycourt Club of Ottawa. The Maycourt Club is one of the oldest women's clubs in the country as well, and they generously provide us with the space for our hospice programs, our residents and our community programs, and provide us fundraise and provide us operating dollars every year. They're what we call a I'm going to remember it, a benefactor who without whom we could not operate. So we are very grateful to the Make Heart Club of Ottawa for the support that they provide. Sorry, I lost the term in my head. It's called a sustaining benefactor. In 2018, we built and opened a new site in the west end of Ottawa called the Ruddy Shankman Hospice, and the residence part is named Hine House. And there we have 12 rooms for people at the end of life, and we have a large area for our community programs. And it's a beautiful build, beautiful gardens, and we are really, really pleased to be able to offer the service in the west end of Ottawa. And we have been trying for over 5 years to try and open a site as well in the east end of Ottawa. So we do have lease space in Orleans at the Briere Continuing Care Residence Saint Louis site, where we have been able to offer our community programs, and I'll describe those in a bit. It's right on the Ottawa River. It's a beautiful site, but to date, we have not been able to find the funds to actually open residential hospice beds. So that's an ongoing issue, and one that we're advocating very strongly for, to meet the needs not only of those living in the East End, but particularly to meet needs of francophones who don't have hospice palliative care services specifically in French. As an organization, we are part of a health system in Ottawa, and there is a hospice palliative care system. So we work very closely with our partners. There is a program called the Champlain Hospice Palliative Care Program that helps coordinate between the hospitals, ourselves, community support agencies, home care, and Bruyere, to make sure that we're trying to do the best by our clients, to help coordinate care, to ensure that we have enough people, health human resources trained, and are receiving the current training. And we work very closely with Briere and Home Care, which is now called Home and Community Care Support Services in Ottawa, to triage patients into care. And so by this way, we are doing our best not to duplicate services, but make sure that when patients are identified or people are identified as needing hospice palliative care, we can get them in the right place at the right time. So the kinds of services we offer: residential end-of-life care. I talked about that. We have 9 beds at the Maycourt site. We have 12 beds at the Ruddy Shankman site, and we'd like to get 10 beds in the east site. And that's really care for those in the last days and weeks of life. Our community programs include day hospice, which is a day away for people who are living with a life-limiting illness. And we offer the day hospice at any one of our sites. Now, right now, they're on virtual because of COVID, but we hope to be opening up again by the end of February, where people have an opportunity to socialize, maybe talk to others about what's going on, share resources, share ideas. We also have a coordinating nurse and a social worker who are there to support if there are any needs in terms of medical or psychosocial needs, and the group shares a lunch together. And it's a great opportunity for respite for a family member, for example. In-home visiting is set up with an initial visit and assessment through a nurse coordinator, and we match clients in the communities with volunteers who have similar interests. So again, they're very well trained, our volunteers, meant to be a support for people living at home, perhaps people who are a little bit more isolated, or also to give caregivers a break so they can get out for that cup of coffee or grocery shopping or whatever it is that they need to do. And they'll get that break once a week. Caregiver support, people who are looking after their loved ones. This is an area where we are seeing more and more need. And again, we provide that through our programs, but we've also started to provide caregiver learning sessions, training sessions, and offering different kinds of support through our family support counselors. And grief and bereavement is a piece that we offer after, whether it's after someone has died, whether it's individual counseling or groups. We even have a grief walk that many people participate in. And our volunteer training and support is a large part of what we do in order to make sure volunteers are trained and ready to help in both the residents and the community programs. So in our residents, for example, as I mentioned, these are people who are here in the last days and weeks of life. And I always like to tell a story here about this particular couple who have given us permission to use this picture and share this story, but it's so typical of what happens in residence. The woman who is dying was widowed, as was the gentleman in this position, in this photo. And they apparently were childhood sweethearts, but hadn't seen each other for 40 some years. But the gentleman saw something on Facebook about her and found out that she was ill. And he came to Ottawa and stayed right with her until she died. It was a beautiful, beautiful story, and something at hospice that we can offer. Family members can stay right in the room with their loved one, can stay overnight if they want to, and share those last moments together. These are just some photographs of what inside a hospice looks like, and hopefully you'll see that it is meant to be much more of a home environment. While we still have to have a hospital bed, for example, in the room, we have couches and nice furniture and doors at our Canada site. The doors open wide enough that in the summer, the beds can go right outside should the person want to do that. And in the summer, we have beautiful gardens who are kept up by our volunteers. These are some pictures of the May Court, which is an older site and has a lot of beauty because of that, and some beautiful gardens, again, kept by our wonderful volunteers. So the idea is to be as home-like, bring in your photos, bring in your plants, have those you care about with you, your blankets and your pillows, whatever it is that is meaningful for you. And these are some photographs of our community programs. So in the community programs, there are lots of activities such as music, art therapy, we have Reiki, often have dogs visiting, good game of cards going on. And during COVID, the picture on the right shows we had developed and put together comfort kits. So our volunteers deliver these comfort kits to people's homes who couldn't get out, and because we weren't able to go into the homes at that time. The art therapy program is one that's quite interesting. If you ever get a chance to visit the May Court, there's some beautiful pieces of art on the wall that were actually done by clients at hospice. And one story I have with a gentleman named Norm who came to Hospice Care Ottawa Day program at the May Court site. I think he was 86 when he first started coming to the program. He had never painted a day in his life, and got involved in our art therapy program with our volunteers. And he started to paint so much that he actually had a garage sale and raised $800 with his paintings and donated them back to hospice. So I always think so fondly of Norm and his ability to take that on in his later years. So last year in 2021, of course, with COVID, we did not see the kind of numbers of people that we have in previous year. We're down about 25%, I would say, from what we do on a regular year, but still we were able to serve 939 people, and 285 people were in residence, and 252 in our community programs, and over 700 who were supported through caregiver or bereavement support. So despite COVID, I think we were able to still reach out to a lot of people who needed it. As I mentioned earlier, we have a team of people who provide supports, and that includes everything from nurses to volunteers to those who do the administrative work. And we are very thankful for everyone. We all have a role to play, whether it's supporting people in their residence in the community or just trying to keep the organization afloat. We have been starting to post stories about meeting our hospice team on social media. So if any of you are social media savvy, please go to our Facebook page, Hospice Care Ottawa, and trying to really highlight the wonderful work that these people do every day and encourage more people to consider hospice palliative care. So one of the stories is Claire in the top corner of your screen. She says, I've been working as a bedside palliative care nurse for the past 6 years. I chose palliative care because I felt called to it. Through my work, I have witnessed the strength of the human spirit, deep compassion and love. It has been a privilege to work as part of such an amazing care team and accompany patients and their family as they navigate this last journey. The other picture here is of Linda, who is one of our personal support workers, and I think her story got cut off here, but essentially Linda is one of our employees that has been with us since very, very early on, probably over 15 years. And people who have experienced hospice will still come back and say they remember Linda, and they remember Linda for the kinds of things that she did. We had one patient who was in hospice, and because she'd been at home in bed, she hadn't been outside for many, many months. So Linda was able to take her out into her gardens, and all she wanted to do was wiggle her toes in the grass. And she was able to do that. So I know they never forgot what Linda did for them. So volunteering is such a key part of what keeps hospice alive. And we know that we try to support our volunteers a lot. We provide a lot of training, and we do survey and find out that most volunteers are pretty satisfied with what they do at hospice, whether it's the support that we provide or the meaningful work that it gives them. And most volunteers will say they get so much more back than they give. But for example, we had almost 50,000 hours of service for our volunteers, which is the equivalent of 30 full-time equivalents. So it's a huge amount of time. And we always joke that that doesn't include the dog time, because of course these photographs are our many hospice dogs, and dogs are very popular at the hospice. And volunteers are so appreciated, because volunteers are not professionals, and sometimes that means that patients or clients might feel more comfortable having that conversation, not talking the medical aspect, but talking about something else that might be more meaningful. And in this little note that came from a person in our residence, she says, "Dear volunteers, thank you so much for your kindness in serving people like me. I very much appreciate how you take care of me and how you put your life on hold to make sure I'm comfortable 24/7. Keep up the good work, and I'm in your hands, and know that I am safe," which is an incredible piece of feedback. So some of you may be wondering, how do you access programs? So this slide, again, may be something that you want to have as a part of the slide deck that we send out. But in terms of accessing our programs, all this information is on our website at Hospice Care Ottawa. Community programs, we have a referral line anyone can call, whether you're a friend, a neighbor, or a professional. You can call and make a referral. You can just say, I don't know what to do. I have a friend who seems like they need help and I don't know what to do. Our nurse coordinators can help walk you through that. Our residents, which is the 24-hour nursing care, this referral is for people right at end of life, and it must be made by a healthcare provider. It could be the social worker, the home care nurse, the physician, but there is a referral process. And again, there's a phone number for that if people don't know that process, or they can find the referral form on our website yet again. So funding is a major concern for us. The funds, of course, in the province of Ontario come through the Ministry of Health, and we are funded at less than 60% of our services, and we do not receive any capital funding. So that means for an organization like ours, we have to fundraise actually over 2 million, I think it's 2.2 million annually, to be able to provide our services and to provide them free of charge. So that's not just to provide fancy things. That's to pay salaries. So it's our operational needs. Most of our funding, or that 40% that doesn't come from the government, comes from individuals who have either known about the hospice, had somebody go through the hospice, or was a client themselves. So we're very grateful to the many individuals who provide donations every year. We do get a lot of donations from in memorials after people die. We have some foundations. I've already mentioned the Maycourt Club, which is a huge benefactor for us, and some bequests and corporate funding as well. And about 20% of that funding also comes from events. I wanted to show you the events. Some of you may have heard of Homes for the Holidays, which is an event we hold every November, again, run primarily by volunteers, where we have tours of beautiful homes across the city. People buy tickets for. The last 2 years, we've had to do it virtually, but we've still had some success with it. The Hike for Hospice is held every May, and that's actually a national event in which we participate. We now have an annual golf tournament, and of course, things like Giving Tuesday and other smaller events that are hosted by either some of our partners or individuals in the community who want to give back. So there are lots of ways that I like to encourage people to help us in that fundraising piece, certainly making donations, supporting some of our special events. On our webpage, there is a application form for being a volunteer, and many of our volunteers work directly with clients, but many don't. Many drive people, or they do administration or fundraising. There are so many opportunities. We do really encourage you, as I mentioned before, to get onto our website, help spread the word, because that's really, really important for us. And currently we are involved in quite a large advocacy campaign. There is, in the province of Ontario, we are in the pre-budget consultation phase. Most of you probably know that in June, there will be an election in Ontario, but they're doing consultation right now for the budget. And we work with our association in Ontario and are advocating very hard for increased funding for hospice. We're the only healthcare organization that provides clinical care in the province that is not fully funded. So hospitals and all the other clinical care areas are fully funded for their work, and we are not. So there's a very strong argument, and I encourage, there'll be things on our website if any of you are interested in helping us advocate for that funding. We will be most grateful. So I think I'm coming to the end of that, of the presentation. And so I'm bringing us back to the myths and facts and the things that we listed right in the beginning. I'm hoping that we have answered some of these things for you. I see there are some questions. Okay, so I think I can get to those. The first statement was, receiving hospice palliative care means you'll die soon. So I hope throughout the presentation, you have learned that actually, no, that's a myth. We encourage people to access hospice palliative care supports as early as possible in their journey. We know that people do better the earlier they access some of the supports and services. And so it does not mean that you will die soon. The residence in our hospice is for people at the last days and weeks of life, but that is only one part of hospice palliative care. Most Canadians want to die at home, and that is true. 70% of Canadians would like to prefer to die at home if they had a choice. But what we do know too is that sometimes that isn't possible. If you've ever cared for somebody at home, you know that sometimes that gets to be too much for a number of reasons. Either the medical needs are too great, or the person or the caregiver, or the person looking after you is exhausted, and that can very often be the case. And so one of the reasons we really encourage or want to have more hospice residence beds is for those people who want to die at home, but it's not possible. This is as close to home as possible. Hospice care is meant for cancer patients. No, that's a myth as well. Some hospices originally started, actually the early hospices in Ontario started for patients with HIV, AIDS at the time. And there were some that were dedicated to cancer, but hospice care now is meant for anybody, any age, any disease. Narcotics are used in palliative care to hasten death. So that's a myth that we come across very often. It's a myth, and people are often come into hospice and are worried that they're going to come into hospice and we're going to, speed along the death process. And that is not the purpose of narcotics. I hope throughout the presentation you've gotten the understanding that the hospice care is meant to provide comfort. It is not meant to hasten death or prolong life. And so narcotics are one of those sets of drugs that are used often for pain control, most often for pain control, but they're also used sometimes to help with the labor of breathing. By that, I mean that for some people, the energy and the shortness of breath is very difficult at end of life, and narcotics can help with that. We are very, very strictly monitored in terms of our use of narcotics, in terms of the systems put in place for counting narcotics, and we are accredited by our provincial association, and that is monitored. So as no, they aren't used to hasten death, they're used to provide comfort. Talking about dying causes too much stress for my loved ones. And I think I talked to you a little bit about advanced care planning and why that's so important. And what we know is that for most people, though it is a stressful topic and it's not one you maybe want to bring up at the dinner table every night, it is a really important topic. And people who are facing end of life usually do want to talk about it but they're afraid to upset others. But it is really important to find the right time and place and comfort level to have that conversation about people's wants and needs at end of life. And everyone has access to high quality hospice palliative care. I didn't talk about that too much in the presentation, but unfortunately, no, it is not the case. We in Ottawa have a lot of hospice palliative care services, but we are still short given the population of 1 million. We have some communities, rural, northern, and other vulnerable groups that do not seem to have access to hospice palliative care. And it's certainly an area that we think is really important and that we need to be better at making sure everyone has that access. I wish I could see how many people you thought got it right. Why we do what we do. So just a few examples of comments that we get, and I have to say it is wonderful that we do receive so many comments of appreciation. And this is one of the toughest times in everybody's life, whether you're the one dying or you're the caregiver, and people are usually so grateful. And we're so happy that we can support in that way.